Good evening, Dean. What is schizophrenia? Schizophrenia is a chronic severe mental disorder characterized by a breakdown in the relation between thought, emotion, and behavior. It involves a range of cognitive, behavioral, and emotional dysfunctions. It is typically marked by psychosis, a loss of contact with reality, and significantly impairs a person's ability to function in social, occupational, and personal settings. There are types of schizophrenia, namely, paranoid schizophrenia, for the signs and symptoms, characterized by prominent delusions, usually persecutory or grandiose, and auditory hallucinations. Patients often exhibit extreme suspiciousness, hostility, or anxiety. Cognitive functions and affect remains relatively intact compared to the other types. For the treatment, antipsychotic medications such as risperidone, haloperidol, cognitive behavioral therapy or CBT, and individual psychotherapy to manage suspiciousness. For the nursing interventions, maintain a professional non-threatening distance, avoid whispering or laughing near the patient, validate the patient's feelings without supporting the delusions. Example, I understand you feel afraid, but I don't see anyone following us. Use clear, direct communication to minimize misinterpretation. Ensure food and medication safety by providing pre-packed or sealed items if the patient is paranoid about poisoning. Second, disorganized schizophrenia or hebephrenic. For the signs and symptoms, disorganized speech or word salad, disorganized behavior, and flat or inappropriate affect. Example, laughing at a funeral. Daily activities like bathing or dressing are severely impaired. For the treatment, antipsychotics, social skills training, and highly structured environments such as milieu therapy. For the nursing interventions, assist with basic activities of daily living or ADLs while encouraging independence as tolerated. Use simple one-step instructions to compensate for cognitive fragmentation. Provide a consistent daily routine to reduce confusion. Gently redirect the patient when speech becomes incoherent. Catatonic schizophrenia. For the signs and symptoms, striking motor disturbances. This includes catatonic stupor, extreme psychomotor retardation, mutism, waxy flexibility, or maintaining a posture for long periods. Excitement, purposeless, excessive motor activity. For the treatment, high-dose benzodiazepines or lorazepam, antipsychotics, and electroconvulsive therapy or ECT if the patient is unresponsive to medication. For the nursing interventions, prioritize physical needs. Monitor for dehydration, malnutrition, and pressure ulcers during stupor. Perform passive range of motion (ROM) exercises to prevent muscle atrophy and contractures. Ensure safety during periods of catatonic excitement to prevent exhaustion or self-injury. Speak to the patient as if they are aware, as they often remember what happened during the stupor. Next, undifferentiated schizophrenia. For the signs and symptoms, the patient meets the general criteria for schizophrenia such as delusions, hallucinations, and disorganized speech, but does not clearly fit into the paranoid, disorganized, or catatonic categories. For the treatment, broad spectrum antipsychotics and comprehensive psychosocial rehabilitation. For the nursing interventions, focused on global symptom management and safety. Monitor for the emergence of specific symptoms that may require targeted intervention. Engage the patient in group therapy to improve social interaction. Next, residual schizophrenia. For the signs and symptoms, occurs when the patient no longer has prominent positive symptoms. Example, delusions or hallucinations, but continues to display negative symptoms like social withdrawal, lack of motivation or avolition, and emotional blunting. For the treatment, atypical antipsychotics, effective for negative symptoms, vocational rehabilitation, and social skills training. For the nursing interventions, focus on her own rehabilitation and reintegration into the community. Encourage the participation in social activities to combat withdrawal. Reinforce medication in compliance to prevent a relapse of positive symptoms. Maladaptive patterns of behavior. Schizophreniform disorder. Description: symptoms identical to schizophrenia but lasting to at least 1 month but less than 6 months. For the signs and symptoms, hallucinations, delusions, disorganized speech, and negative symptoms. For the treatment, antipsychotic medication and brief psychotherapy. For the nursing interventions, monitor for the progression of symptoms into chronic schizophrenia. Educate the family on early warning signs of relapse. Next is schizoaffective disorder, a hybrid disorder featuring both schizophrenia symptoms and a major mood disorder or depression or mania. For the signs and symptoms, psychosis, delusions, or hallucinations occurring for at least 2 weeks in the absence of a major mood episode, alongside periods of clinical depression or mania. For the treatment, a combination of antipsychotics, mood stabilizers such as lithium, and antidepressants. For the nursing interventions, assess for suicidal ideation, especially during depressive phases. Monitor for manic behaviors, example, impulsivity and hyperactivity. Educate the patient on the importance of complex medication regimens. Next, delusional disorder. A presence of one or more non-bizarre delusions for at least 1 month. General functioning is not markedly impaired. For the signs and symptoms, fixed beliefs, erotomanic, grandiose, jealous, persecutory, or somatic. For the treatment, antipsychotics often less effective than in schizophrenia, and individual therapy. For the nursing interventions, avoid direct confrontation of the delusion to prevent a power struggle. Focus on the reality of the patient's feelings rather than the logic of the delusion. Promote distraction techniques. Brief psychotic disorder. It is a sudden onset of psychotic symptoms lasting at least 1 day but less than 1 month, often triggered by a severe stress. For the signs and symptoms, emotional turmoil, confusion, and rapid shift in affect. For the treatment, short-term antipsychotics and removal of the stressor. For the nursing intervention, provide a calm, safe environment to reduce sensory overload. Assess for the specific stressor and assist with coping mechanisms. Shared psychotic disorder or polyadiocose. A delusion develops in an individual who is involved in a close relationship with another person, the inducer, who has already a fixed delusion. For the signs and symptoms, accept the primary delusional system. For the treatment, separation of two individuals. The secondary person often recovers once separated. For the nurse interventions, support a separation process and provide individual therapy for the submissive partner. Promote independent thinking and reality testing. For the fetal alcohol syndrome or FES, a condition in a child that results from alcohol exposure during the mother's pregnancy. For the signs and symptoms, physical, small head circumference, thin upper lip, smooth philtrum area between nose and lip, and small palpebral fissures. Cognitive, poor memory, learning disabilities, and low IQ. For the behavior, poor impulse control and skills. Treatment, no cure management involved. Involves speech therapy, physical, and special education. For the nursing interventions, monitor growth and developmental milestone closely. Provide nutritional support for infants with failure to thrive. Educate parents on behavior management techniques and the need for highly structured environment. Next, attention deficit hyperactivity disorder or ADHD. Excuse. A neurodevelopmental disorder characterized by persistent patterns of attention and or hyperactivity, impulsivity. For the signs and symptoms, inattention, difficulty sustaining focus, messy work, forgetfulness. Hyperactivity, fidgeting, inability to seated. Excuse me. Excessive talking, impulsivity, interrupting others, inability to wait for a turn. For the treatment, stimulants, methylphenidate, non-stimulants, atomoxetine, and behavioral therapy. For the nursing interventions, provide a low stimulus environment for tasks requiring focus. Break down large tasks into small, manageable steps to avoid confusion. Use a reward system for positive behaviors. Administer stimulants in the morning to prevent insomnia. Next, autism spectrum disorder or ASD. A complex developmental condition involving persistent challenges in social interaction, speech and nonverbal communication, and restricted repetitive behaviors. There are types. Note, in the DSM-5, there are now merged under the umbrella of ASD, but historically included. Autistic disorder. Significant language and social delays. Next, Asperger's syndrome. Milder symptoms, social challenges, but typically no language or intellectual delay. Next, pervasive developmental disorder or PDD, NOS. Atypical autism. For the signs and symptoms, lack of eye contact, repetitive motor mannerism or hand fluffing, insistence on sameness, and delayed language development. For the treatment, applied behavior analysis or ABE, educational therapy, and speech therapy. For the nursing interventions, maintain a strictly consistent routine, notify the patient in advance of any changes, communicate using brief, concrete statements, identify and minimize sensory triggers, loud noises, bright lights, allow the child to keep a comfort object from home. What is intellectual disability? Or commonly, mental retardation. Intellectual disability, or formerly referred to as mental retardation, is a generalized neurodevelopmental disorder characterized by significantly impaired intellectual functioning, an IQ below 70, and adaptive functioning deficits in practical, social, and conceptual skills. It originates before the age of 18 and results in limitations in everyday living. Levels of intellectual disability. Mild, IQ 50 to 70. Historical term, moron. For the signs and symptoms, often not identified until school age. Can acquire social and communication skills. Functions at approximately a 6th grade academic level. Can achieve a social and vocational inadequacy with support. For the treatment, special education, vocational training, and social skills coaching. For the nursing interventions, use simple, concrete explanations and avoid abstract concepts. Provide repetitive reinforcement or learned tasks. Focusing independent living skills like money management and hygiene. Encourage the participation in a community-based social programs. Next, moderate, IQ 35 to 49. Historical term, imbecile. For the signs and symptoms, obvious developmental delays in early childhood. Functions at a 2nd grade academic level. Can perform semi-skilled work under supervision. communicates in simple ways. For the treatment, speech therapy, occupational therapy, and supervised residential placement. For the nursing interventions, use visual aids and demonstrations rather than verbal instructions. Establish a highly structured and predictable daily routine. Supervise closely during EDLs to ensure thoroughness. Example, brushing teeth. Provide protective environments for social interaction to prevent victimization. Next, severe. IQ 20 to 34. Historical term, idiot. Note, lower range. For the signs and symptoms, very limited communication, few words or gestures. May learn elementary self-care, example, feeding, but requires constant supervision. Significant motor impairments. Treatment, behavioral modification, physical therapy, and intensive habit training. For the nursing interventions, focus on nonverbal communication cues, facial expressions, body language. Implement strict safety measures to prevent injury, like padded corners sa mga tables and other things. Use consistent caregivers to build trust and recognition. Provide frequent skin care and repositioning motor skills are severely limited. Profound IQ level below 20. Historical term, idiot. For the signs and symptoms, minimal capacity for sensory motor functioning. Requires total care and nursing support. May have associated physical deformities or neurological conditions. For the treatment, sensory stimulation therapy and 24-hour physical care. For the nursing interventions, prioritize physiological needs, hydration, nutrition, and bowel and bladder management. Prevent complications of immobility, pneumonia contractures, pressure sores. Provide sensory stimulation through soft music, touch, or colorful mobiles. Monitor for subtle signs of pain or distress since the patient cannot verbalize. Differentiating delirium and dementia. Onset. Delirium is acute and sudden, hours to days, while dementia is chronic and progressive, years or a lifetime. Consciousness. Delirium involves fluctuating levels of consciousness and reduced awareness, while dementia involves clear consciousness until terminal stages. Reversibility. Delirium is often reversible if the underlying cause, such as infection and drug toxicity, is treated. Dementia is generally irreversible and permanent. Delirium causes extreme inability to focus, while dementia primarily affects memory and orientation initially, with attention remaining intact early on. What is Alzheimer's disease? Alzheimer's disease is a progressive neurodegenerative brain disorder characterized by the accumulation of amyloid plaques and tangles, leading to the death of neurons and brain atrophy. It is common cause of dementia. Alzheimer's disease details. For the signs and symptoms, first is amnesia, short-term memory loss, early progressing to long-term loss. Next, apraxia, difficulty finding words or understanding speech. Next, apraxia, inability to perform purposely motor activities such as tie shoes. Next, agnosia, failure to recognize familiar objects or people. Sundowning, increased confusion and agitation in the late afternoon or evening. For the treatment, first is cholinesterase inhibitors or donepezil, Aricept, to improve cognitive functions. NMDA receptor antagonist, memantine, Namenda for moderate to severe cases. Symptomatic antipsychotics for agitation, antidepressants for mood. For the nursing interventions, for the safety, remove area rugs, install grab bars, and use door alarms to prevent wandering. Cognitive support, use large face clocks, calendars, and labels photos of family members. Validation therapy. In later stages, do not reorient if it causes distress. Instead, validate the feelings behind their confusion. For the nutrition, provide finger foods if the patient is too restless to sit for meals. For the cognitive support, assess family for caregiver roles train and provide resources. For the eating disorders, first is PICA or PICA. Persistent eating of non-nutritive, non-food substances for at least 1 month. For the signs and symptoms, consuming dirt, clay, paint, chips, hair or ice, intestinal obstruction or lead poisoning. For the treatment, behavioral therapy and corrective nutritional deficiencies like iron or zinc. For the nursing intervention, remove hazardous non-food items from the patient's environment. Monitor lab values for toxicities or anemia. Educate family on the risk of infection or bowel perforation. Next, remuneration disorder. Repetitive regurgitation of food which may be rechewed, reswallowed, or spit out. For the signs and symptoms, weight loss, tooth decay, and bad breath occurs without nausea or involuntary retching. For the treatment, diaphragmatic breathing exercises and habit reversal techniques. For the nursing interventions, observe the patient during and immediately after meals. Encourage deep breathing after eating to prevent the regurgitation reflex. Maintain a calm, non-judgmental environment during meal time. Next, anorexia nervosa. Intense fear of gaining weight and a distorted body image, leading to self-starvation. For the signs and symptoms, extreme thinness, lanugo, fine hair, amenorrhea or no periods, bradycardia, and cold intolerance. For the treatment, nutritional rehabilitations, SSRIs once weight is stabilized, and CBT. For the nursing interventions, implement strict bathroom lockout for 1 hour after meals to prevent purging. Monitor electrolyte levels, especially potassium and cardiac rhythm. Set a target weight and provide rewards for weight gain, not just eating. Avoid discussing food or calories. Focus on feelings and body image. Next one is bulimia nervosa. It is a recurrent episode of binge eating followed by compensatory behaviors such as purging, laxatives, excessive exercise. For the signs and symptoms, Russell signs, calluses on the knuckles, parotid gland, swelling, chipmunk cheeks, and dental enamel erosion. For the treatment, fluoxetine or Prozac is FDA approved, interpersonal therapy, and CBT. For the nursing interventions, monitor for hidden stashes of food or laxatives, assist the esophageal tears or Mallory-Weiss tears or gastric rupture. Help the patient identify triggers of binging, example stress and loneliness. Next one is binge eating disorder. It is a recurrent episode for eating large quantities of food with a sense of loss of control but without compensatory purging. For the signs and symptoms, obesity, eating rapidly until eating uncomfortably full and feelings of guilt or disgust afterward. For the treatment, lisdexamfetamine or Vayner's, CBT, and weight management programs. For the nursing interventions, assist the patient in keeping a food and emotion diary. Promote healthy, non-food related coping mechanisms for stress. Encourage small stress nutrient-dense meals to stabilize blood sugar. That will be all. Thank you, Dean.